Welcome to the deep dive. Today we're really getting into something critical. The crisis-gripping Dutch youth care.
It's a heavy topic, definitely.
Yeah, and our mission here is to go beyond just the headlines, to help you understand the nuts and bolts of things like ondertoezichtstellingen, those are supervision orders,
Yes, yeah.
and huisplaatsingen, which means kids being placed out of home, UHP.
That's right.
We're drawing a lot from Harry Berndsen, an independent social pedagogue. He's got decades of experience, and he actually reviewed 150 youth care case files.
An incredible amount of data, and his interview on Blackdix really lays out his critical view.
Exactly. So by the end of this, you should have a much clearer picture of what's actually going wrong, some surprising facts, and, well, maybe some paths forward.
And what's interesting about Berndsen is his background in social pedagogy, but also organizational consultancy. He looks at the whole family system.
Not just the child in isolation.
Precisely. It's a holistic view.
Yeah.
And look, the research he cites, like the boomerang policy dissertation with Stellard, it's pretty stark.
Stark how?
It basically says that over 50 years, the problems haven't just stuck around, they've actually gotten worse. It's well documented.
That's a sobering start. So, wait, let's pull back the curtain. What are these foundational flaws Berndsen found? You mentioned something about legal knowledge.
Yeah, it's kind of shocking, actually. The book, Transparent Youth Care in Practice, points this out clearly. Family guardians often lack basic legal knowledge.
How is that possible? Isn't there specific training?
Well, that's the thing. There isn't. No specific degree or dedicated training program in the Netherlands for this incredibly important role.
Wow, no specific training. That feels like a huge gap in such a sensitive area. What does that mean in practice?
It means the implications are pretty far-reaching.
Yeah.
You have guardians advising judges on really complex stuff, like, say, child-parent attachment after a divorce.
Right, like how connected a child feels to each parent.
Exactly. And sometimes this advice is given without proper deep research. The Guide to Attachment really stresses how crucial that research is.
So without that,
Well, you might get situations where a child, maybe one with an insecure or even fearful attachment to a parent, is still pushed into contact arrangements that aren't really in their best interest.
okay, so legal gaps, psychological understanding gaps, what else?
There's also a lack of basic project management skills. These guardians are meant to lead temporary interventions like an OPS or a UHP.
Right, overseeing the process.
But they often struggle to create clear, measurable action plans, specific steps to guide what needs to happen.
So it's not just about understanding the law or the child, but also managing the case effectively. What about how they actually talk to families?
That's another big one. Communication. Across the board, really guardians, child protection council staff, veilig thuis workers, they often miss key relational cues. Emotional signals.
Like what?
Like, maybe not directly addressing a parent's anger. That anger often comes from fear or frustration, right?
Makes sense.
But if it's ignored or handled poorly, it just escalates things. Leads to miscommunication, more conflict, instead of actually resolving anything.
Okay, so we've got these foundational issues, training, methods, communication. For a family caught up in this, it must feel like navigating a maze.
Absolutely.
Can we map out who's who in this labyrinth? You've got the Ministry of VWS Health and Youth Care, Ministry of Justice for the Child Protection Council.
Right. Then Youth GGZ for mental health.
Veilig thuis, that's safe home, first point of contact, often. The Raad voor de Kinderbescherming, the Child Protection Council itself.
Certified institutions used to be Bureau Jeugdzorg.
And then the child judge, the municipalities, who now manage a lot of youth care, and the KMC Institute for Quality Checks.
It's a sprawling system. Lots of players, semi-privatized services, municipalities juggling hundreds of providers.
That complexity alone sounds like a problem. Where does a family's journey usually start?
Often, yeah. It starts with veilig thuis, safe home. That's where anyone, literally anyone, a neighbor, teacher, doctor, can report a concern about a child.
Anyone?
Yeah.
Okay. And what's supposed to happen then?
Well, the professionals there have a 5-step plan they're supposed to follow. And a key step is informing the parents before a formal report is made.
Supposed to. But does it happen?
Alarmingly often, that step gets skipped.
I can see how that would immediately cause problems. What happens when parents aren't told?
Well, it feeds into this issue of false reports. You get reports coming from, neighbor disputes, arguments at school, just burenruzie, a neighbor's quarrel.
People using the system to settle scores.
It happens. Sometimes they call it fire at veilig thuis. And then the investigation they do, the triage, it's often pretty superficial, maybe a phone call, 1 or 2 interviews.
That doesn't sound very thorough.
It's not the deep truth-finding investigation the law actually requires, the WMO, the Social Support Act. That act demands proper factual assessment.
So instead, you get
Reports based more on opinions, maybe hearsay, than hard facts. Parents often read these reports and say, this isn't even describing my situation.
and these opinion-based reports can lead to serious action. Is there data on how often these initial suspicions are actually valid?
There is, and it's pretty sobering. Marcia Schouten's dissertation found that 92% of investigated child abuse suspicions were unfounded.
92%.
Yeah. And in polyclinics, it was even higher, 97%.
Wow. That suggests the system is, well, crying wolf a lot of time.
It does. It causes huge trauma for families unnecessarily and wastes resources. Plus, Veilig-Duis often just passes the case to the ROD, the Child Protection Council, for another investigation.
So families go through it twice.
Sometimes, yeah. They call it the protection table.
That.
It really makes you question the added value of Veilig-Duis, especially since its predecessor, the AMK, was merged partly because it wasn't efficient enough.
Okay, so potentially flawed initial inquiries, sometimes duplicated. Then the case lands with the Child Protection Council, the ROD. Is the investigation more rigorous there?
Well, the staff at the ROD typically have HBO education that's higher vocational training. It's practical, but the sources argue it often lacks the deep research methodology training you'd get at a university level.
So they aren't trained as academic researchers.
Generally, no, not in methodology or statistics, so their investigations, again, are often mainly interviews and reviewing the reports. They already have reports that might be flawed, as we just discussed.
It sounds like the system is almost set up to find problems, rather than objectively check if there are problems.
That's a key critique, yeah. The ROD's mandate is often interpreted as find concerns, not verify if concerns exist.
Find concerns. What does concern even mean in this context?
That's part of the issue. It's vaguely defined as just the difference between reality and desirability.
Right.
It's rarely spelled out specifically.
That sounds incredibly subjective.
It is, and it means minor issues can get blown out of proportion and used to justify interventions.
Okay, so let's recap. Opinion-based reports, investigations by staff maybe not fully equipped for deep research, a mandate to find concerns. How does all this feed into what the child judge decides?
This is where it gets really critical. The child judge, they're usually not trained as pedagogues or behavioral scientists themselves.
They're legal experts, primarily.
Right, which means, according to Berndsen, they become completely dependent on the information they get from the ROD and the certified institutions.
And how often do they follow that advice?
Berndsen estimates they follow it in about 95% of cases. There's a kind of systemic loyalty.
95%. Wow. What happens if parents try to bring in their own expert? Is that allowed?
Technically, yes. Article 810A of the Civil Code allows for independent counter-expertise. But in practice, judges often reject these requests.
On what grounds?
They might declare the external expert unqualified, often without really knowing their background. Harry Berndsen himself has apparently experienced this. It suggests a sort of closed loop, a reluctance to accept outside scrutiny.
Almost like an echo chamber. What does this dependency mean for the families?
Well, Berndsen's manifest makes a pretty devastating claim. 70% of supervision orders, the OTS, are unnecessary and lack proper evidence.
70%.
Unnecessary.
That's his finding based on those 150 dossiers. And these orders, meant to be temporary, can drag on for 10 years or more.
And who evaluates if they're working?
Often, the family guardians evaluate their own work. And if things aren't improving, the blame tends to fall back on the family, not the intervention itself.
That doesn't sound right.
And the judge's orders themselves often lack specifics. Civil Code Article 255 says they need to list specific, measurable threats to the child's development.
But they don't.
Frequently, they're vague, which makes it impossible to create a truly effective plan to address the supposed problems. It traps families in a cycle.
And the most drastic step, placing a child out of home, the UHP. That's supposed to be the absolute last resort, right?
Absolutely. An ultimate measure. But again, the RAD often doesn't thoroughly investigate alternatives first. How common are UHPs in the Netherlands compared to elsewhere?
Shockingly common. Berndsen calls it a world record. Our rates are apparently 50% higher than Denmark's. And France, they have virtually none. They focus on institutional support for the family.
That's a massive difference. What's the impact on kids when they are placed out of home?
It's recognized as deeply traumatic. It causes relational damage, identity problems, issues adapting later on. And disturbingly, the rate of sexual abuse in foster families is reported to be twice as high as in biological families.
Twice as high.
Yeah. Think about the Meisje van Vlaardingen case, that little girl who was horribly abused. The Rod had described her foster home as loving. It's just harrowing.
We've talked about the system's flaws, the training gaps, the biased investigations, these awful statistics. To really understand the human cost, let's look at that case study you mentioned from the source material, the 12-year-old girl and her mother.
Right. This case really shows how things can just unravel. It highlights how easily words get twisted.
How so?
So, the mother, under immense stress, maybe has an angry outburst. Says something desperate like, I'll drive myself into a tree if I lose my kids.
Okay, clearly distressed.
But in the report, it gets labeled suicidal. No clinical assessment, just labeled. Or she says something defiant like, I have nothing to do with your laws.
Frustration, maybe?
Probably. But it's logged as sovereign thinking, implying she's anti-system, unable to comply. These stress reactions become damaging labels.
A spiral of misinterpretation, like you said.
Yeah.
What happened next in that specific case? It sounds like it escalated quickly.
Dramatically. So a meeting with the family guardian gets rescheduled from Friday to Monday. Simple enough, right?
Seems straightforward.
But the RAD misinterprets this. They log it as mother not showing up on Friday. And that triggers an emergency UHP and out-of-home placement.
Just like that, based on a scheduling mix-up.
Apparently so. Then the removal itself, it was traumatic. 10 people show up, 4 police, 6 youth care workers.
10 people for one child.
Yes. And the police reportedly didn't have the right ID or authorization to enter. The child, understandably terrified, runs to a neighbor's house.
Oh, no.
And then the mother gets arrested for abducting her own child.
Abducting her own child because the child ran away in fear?
That was the charge. The child was later put in a Gesenshuis, a group family home, but then the child ran away from there, reporting abuse, having blue marks.
This is awful. Where's the child now?
Currently, unlocatable. And the mother is still in jail, suspected of kidnapping. The address of that foster home is kept secret from her.
That's just unbelievable. And you mentioned this connects to conflict divorces, too.
Yeah, it's a huge issue.
Right.
Around 16,000 kids a year lose contact with a parent, usually the father, in these fight divorces.
And youth care gets involved.
Often, yes. But instead of de-escalating or analyzing the conflict properly, they sometimes make it worse. They might lack proper conflict analysis skills or research on attachment.
They take sides.
Frequently. One parent's claims might lead to the other being labeled borderline or narcissistic without objective assessment. What starts as maybe subtle control by one partner can escalate, and youth care professionals often miss the signs of real abuse dynamics.
This case really drives home the real-world impact. It's devastating. Looking bigger picture, Berndsen talks about youth care acting like a state within a state. What does he mean by that?
He means it's largely autonomous, lacking effective external oversight. Even the official youth care inspection sometimes seems to cover for the sector.
You mentioned the Toes Logan affair earlier, the benefit scandal.
Exactly. A situation where flawed dossiers were admitted, but the out-of-home placements were still somehow deemed justified. It points to a lack of accountability.
And then there's the money. You mentioned financial incentives.
Yeah, and it's uncomfortable, but we have to talk about it. An OTS, that supervision order, brings in about 13,000 euros per child per year for the institution.
13,000 euros.
And a UHP, placing a child out of home. That costs the municipality maybe $10,000 directly, but the indirect costs can push it up to $70,000 per child per year.
That creates a financial pressure, doesn't it? A drive towards intervention.
It certainly seems like a perverse incentive is built into the system. It's alarming.
And what about decentralization back in 2015? Moving responsibility to municipalities, did that help?
Well, the intention was good, maybe, bring care closer. But in practice, many municipalities, especially smaller ones, just didn't have the expertise or resources.
So it led to problems.
Often, yeah. Poor budgeting, fragmented management. Berndsen's core point here is crucial. The issue is functional, not structural.
Meaning just changing the structure, like decentralizing, won't fix it.
Exactly. If the core way things function, the training, the methods, the mindset is broken, shuffling the boxes won't help. He also says fear is a bad advisor.
Fear? Who's fear?
Fear among judges and professionals. Fear of getting it wrong, fear of blame. So they opt for intervention, for the UHP or OTS to cover themselves, even if it's not truly best for the child. They might think, look, I'm not the expert here. I have to listen to the Raad.
Okay, so if it's a functional problem, driven partly by fear, what does Berndsen propose? What are his solutions? They sound like they'd need to be pretty radical.
They are quite radical, yes. And they aim to shift the whole paradigm. First, merge Velikhuis back into the Raad. Consolidate the investigation function.
One investigation body, separate from providing help?
Exactly. Separate investigation from implementation. Streamline it, reduce that duplication we talked about.
Okay, what else?
Second, investigations should be done by academically trained researchers, proper behavioral scientists. Let the HBO trained professionals focus on actually providing the support and help using their practical skills effectively.
So, specialists for investigation, specialists for support.
Huh.
Makes sense. And the boldest idea?
Abolish the single-child judge. Replace that role with a 3-person panel.
A panel. Who would be on it?
An orthopedagogue generalist, a jurist, and a developmental psychologist, all registered professionals.
Interesting. Why that mix?
The idea is to reframe child protection entirely, make it primarily a pedagogical matter, not just a legal one. Focus on the child's development and well-being needs, not just legal procedure.
So, this deep dive, it's really uncovered a system with some deeply concerning flaws, lack of training, potential biases, huge human costs.
And those surprising financial drivers, yeah.
It feels less like a critique and more like a call for a fundamental rethink about how we protect children, moving away from just labels and procedures towards real understanding and support.
That's the hope.
We hope this has given you, our listener, a clearer picture. It's unsettling stuff, for sure, but hopefully empowering, too, knowing what's really going on in a system that so desperately seems to need reform.
And maybe it leaves us with a final thought, a question to chew on. If other countries, developed nations, manage child protection with far, far fewer kids being removed from their homes...
Like France, with almost none.
Right. What are we really missing here in the Netherlands? How do we get from a system that seems rooted in control, maybe even fear, and often escalates problems, to one that's actually built on trust, real family support, and solid professional pedagogical expertise?